Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I'm talking about pee and poop accidents. And the research says that you're much more likely, 90% of people who have pee and poop accidents are constipated. So constipation is the culprit. Most of the time, there are rare problems that happen outside of it, but otherwise it's constipation. And a lot of times parents don't believe their child is constipated because they do have bowel movements. The research says that constipation is when you have hard, dry, brittle poops that go into the rectum and block the rectum. But sometimes the poop that is above can be soft and mushy and go out around that. So you can still be having poops, but still be constipated. So how do you know if your child is constipated? Well, we talked about before that if your child's poops are pellets or long, hard logs or bumpy sausages, that they're more likely to be constipated. You're wanting soft, mushy snakes as poops. But you know what? Parents tell me that, I haven't seen my child's poops in quite some times. So I don't really know what their poop looks like. Well, you can ask them. The other thing that they don't know often is if they're having huge poops. I mean, these are poops that clog the toilet. Sometimes you know about that. If that's happening, then your child is constipated. Another thing that you might know is that they have frequent UTIs, urinary tract infections. If that's happening to your child, it's likely that they're constipated. If they're wetting their bed, well, you know about that. Then they're likely constipated. What they say is, if you're wetting your bed, you're constipated unless proven otherwise. So that's a way to know if your child is wetting the bed, they're probably constipated 90% of the time. If they're having leaks during the day, if they're wetting their pants during the day, they're probably constipated. If they're pooping more than twice a day, then they're more likely to be constipated. If they're having a big variation in the type of poops, anywhere from those hard blobs that are big to mushies to nothing, it varies back and forth a lot, then that's a real likelihood that you're constipated. If they're itchy on their anus, if it itches, you're likely constipated. If you're noticing when you're doing the laundry, you're looking at their underwear and oh my God, there's skid marks back there regularly, skid marks are a sign that your child is likely constipated. If they're having belly pain is classic for bad constipation. If your child is going somewhere to hide, to go to the bathroom, like they're still in pull-ups or diapers and they're going in to hide, the likelihood is that they're constipated. We talked about it before. How do you know for sure if your child is constipated? You have to get an x-ray. And the doctor has to be prepared to be able to do that x-ray because they need on that x-ray to have a scale that they can read relative to your child's rectum. If that rectum is measuring more than 3 centimeters, that means it's overstuffed, it's too full, then your child is constipated. Normal rectum size is 2 to 2.5 centimeters. On the x-ray, if it shows bigger than that, your child is definitely constipated. And that's the hallmark of knowing definitively if your child is constipated. And that way you can be sure that's the reason behind your child's problems with pee and poop accidents. I'm having fun with this potty talk. I hope you're enjoying it too. And we'll look forward to talking to you next time. Thanks a lot. Bye-bye.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.